السلام عليكم ورحمة الله وبركاته. بسم الله الرحمن الرحيم. طبعا محاضرتنا هذا اليوم أول شيء أحب أرحب بكم. أنا الدكتور أمجد قاسم محمد حسب ما قدمت لكم نفس اليوم، خريج جامعة طهران للعلوم الطبية، وحاليا إن شاء الله نتخرج من جامعة جولستان في دكتوراه التقنيات الطبية. أول شيء حبيت أختار لكم موضوع حسب منهجكم هو الانترافينوس catheter and cannula. That means we can explain this by introduction. The catheter is a thin sterilization or sterilized tube made from medical grade materials and can offer a broad range of medical conditions. Catheters can also be inserted into a body cavity مثل ما حكينا اليوم بالعملي a body cavity, duct or vessels for drainage, administration of fluid or gases. Catheters used to access for surgical instrument and also to perform a wide variety of other tasks depending upon the type of catheter. Intravenous or IV therapy is beneficial for several conditions like what? And medical situation including like what? As we talk, dehydration, nutrition, surgery, blood transfusion, chemotherapy and medication and administration. Okay. A small tube placed into peripheral vein in order to administer medication directly into the circulation is known as a peripheral intravenous catheter. In addition to medication administration, peripheral intravenous catheters are used to what? To withdraw blood from, as we say today, veins for advancing peripheral intravenous and also catheters are equipped with additional safety features to avoid needle stick injuries due to their direct contact with circulatory system. Peripheral intravenous catheters are prepared with non-irritant materials such as silicone, which don't have side effects even when peripheral intravenous catheters are left in contact with the circulatory system for the several months or weeks. Peripheral intravenous catheters are commonly used for vascular access medicine administration or administered through a peripheral intravenous intravenous catheter enters directly into the blood flow and thus show rapid action. With the advantage of rapid action, peripheral intravenous catheters are commonly used in emergency patients, surgical patients, and patients suffering from vomiting, pediatric patients, unconscious patients, and the elderly population who face difficulty in swallowing medications. Factors such as aging of population and advancement in surgical and treatment technologies resulting in increased surgical procedures are driving the global peripheral intravenous catheter market towards growth. Cannula. Now another type from the catheter, it is cannula. Cannula is a thin tube which is inserted into the human body, veins, or body cavity to introduce medication, removal of fluid, or to insert the surgical instrument. Cannula is used surrounding by the trocar needle with inner and outer surface, which allow puncturing of the body in order to get enough space. It is also named as intravenous IV cannula. The normal cannula size mainly range around 14 to 24 gauge. There are various types of cannula such as venous cannula and arterial cannula and nasal cannula or an oral nasal cannula And the venous cannula is used for inserting in veins for the removal of blood samples and for the administering the medicine. Cannula definition, we can define it as a procedure by which a little plastic cylinder, a cannula, is embedded into a vein. The consequent venous access can be utilized for the organization of liquids, drug, and nourishment. Sometimes blood tests can likewise be gotten from the cannula. Now look to this picture. An arterial cannula is used to insert in the artery, as we said today, in the artery of a human body, commonly in the radial artery during major operations such as bypass. As we said today morning, if you remember that, bypass surgery, we can use the radial artery. I'll show you where is the radial artery, if you remember. Surgery and are also used to measure beat to beat blood pressure. This is a painful procedure that lead to stress and anxiety. The nasal cannula or the oral nasal cannula used in the insertion into nostrils and mouth, and also for delivering oxygen or to measure the airflow into the nose. Some lines about IV cannula, like what? Intravenous cannulation is a process by which a small plastic tube is inserted into a peripheral vein. The subsequent venous access can be used for the administration of fluid, medication, and nutrition. In some cases, that means the common cases, blood samples can also be obtained from the cannula. The process of cannulation can be divided into 4 steps: explanation and consent and preparation and procedure and aftercare. Okay, another slide. Uses, we can use the venous cannula to insert it into a vein primarily for the administration of intravenous fluid, number 1, obtain blood samples, number 2, and administrating medication. An arterial cannula is inserted into an artery, commonly the radial artery, and is used during major operation and the critical care are as to measure beat to beat blood pressure and to draw repeated blood samples. IV cannula is amongst the most extensively used medical disposable healthcare professional presented the large end use market for cannula. Consist of IV cannula. Okay, from what the cannula are content. Confirm the patient identifications. Okay, check full name and hospital number. Confirm against patient wristband. Explain rationale for the procedure. Describe the procedure. State the importance of procedure. Explain the risk of the procedure to the patient. Infection can be minimized by sterilized equipment and aspected non-touch technique and structure method. Or I said non-touch technique by what? By gloves. If you know, structure method or another structure hit nerve, artery, or bone, and the last one is hematoma or phlebitis may develop. The preparation of IV cannula. When in the treatment room, prepare your equipment on an appropriate equipment trolley. Decontaminate your hand. That means sterilization your hands. Clean your trolley and plastic tray with appropriate aspect agent, example alcohol, allowing to dry fully. Decontaminate your hands. As I said, check expiry date of saline solution with another member of staff. Clean the top of the saline vial with a chlorhexidine, wipe and open. Draw up saline into the sterile syringe and discard the needle. And in the clinical day I can explain what I said. Open the bioreactor backing, flush it, and place in the tray. Gather the rest of the equipment into the plastic tray on the trolley and move to the patient bedside. Equipment required: cannula pack and chlorhexidine wipes, pre-primed, and bioreactor saline filled syringe, and tourniquet, incubate, and sharp spine. Okay, the procedure of IV cannula. Don your gloves and apron. As I said, gloves. Clean the puncture site with the chloroprep wipe in across each formation and allow to air dry. Apply the tourniquet and do not repapillate the clean skin. Placing traction on the skin below the intended puncture site. Insert the cannula with the bevel up. Now look at this important note. Look to me. Placing traction on the skin below the intended puncture site. Insert the cannula with the bevel up at an angle of 30 degrees into the puncture site. Advance your cannula and observe flashback. Hold the needle introduced still whilst advancing the cannula forward over the needle and fully into the vein. Release the tourniquet and deposit the needle into the sharp spine. Okay, and also we continue. Connect your bionectar to the cannula. Square the cannula in place with sterilized dressing. Ensure not to cover the puncture site with the tub when the securing down, as then can cover up any possible filaments develop. Flush the bionectar and cannula with 5 ml of saline. No resistance should be filled. Remember that? No resistance should be filled. Check for any signs of extravasation and tissuing around the cannula site. Remove cannula if suspected. After insert IV cannula, instruct the patient to inform the nursing staff if cannula site becomes painful, red, hot, as I said, is hotness, redness, tenderness, or swallowing, that means tenderness. The area around the cannula feels weight or the dressing is coming close. The cannula is limiting their self-care. Thank the patient and leave the patient's bedside. Ensure the correct cannula insertion documentation is filled out completely and place in the patient's notes. Inform the nursing staff and place any cannula care pathway stickers into the nursing notes. Ideally, the cannula, now this is very important note, ideally the cannula should be checked and flushed 3 times a day and should be removed after 72 hours. And thank you for your listening and good luck.